not like that. You challenge me with any case, we can always show that. We did for a doctor who had a thalamic infarct, and it was thalamic hemorrhage was there. 2 years he's kept on doing physiotherapy. Somehow he got totally disgusted, and we did hyperbaric oxygen, and from 0 we could get up to power 2 or 3 here. 5 was not possible here. We didn't promise 5 at all. Somebody comes to me acutely, within a week or 10 days, I can always promise good powers back. So this is all about hyperbaric oxygen. Any questions? This will explain everything. This slide will explain you everything. This is the normal bottle, and this is the hyperbaric chamber. You are just compressing this particular stuff, oxygen molecules. Oxygen molecules, they start, size gets reduced and they diffuse into things properly, right? And it goes to the remotest part. Traffic in Hyderabad, what is the main problem? End mile connectivity, right? You come up to metro, uske baad kya karte hain? End mile. So the same thing happens here also. It goes up to there. From there are some ischemic lesions and all that. So end mile connectivity problem can be sorted by just doing hyperbaric oxygen. And you need to do other things also. It is not a just, but it is a very good modality where you can immediately show the patient there is a difference, and you have to work out everything has to be worked out, right from nutrition, right from here. Dr. Saab, you look puzzled or something like that. Anyway, because this is a slightly difficult thing here. We took around 30 more than This is 94. I completed radiology. This 30. It is not easy to understand everything. I was telling about lymphatics. Make use of your lymphatics. Why we keep telling people to move around is to keep your lymphatics active, right? And if you don't keep your lymphatics active, trampoline.
I have kept it in my clinic. So
okay,
that all
you
my
are
patients
making money
buy.
out of that.
No, I tell patients to buy. I am helping patients to work on their lymphatics.
It's amazing. If I have asked you what is the best exercise you can do, brushing, walking, knee joints jate bhaiya.
Trampoline. Even for your gut health.
It's amazing.
And 5 minutes
it's
you're not
amazing.
able to
Only
do it.
thing is you need to be careful about how do you do it and all that. It's amazing thing. It is. I can give you 10 reasons why you should go for that particular stuff. Everything is this oxidative stress. Because of this only we are here. Free radicals kind of thing. So this will be my last slide, right? I will not keep you. Oxygen levels, right? Room air, you have got 160 millimeters air, right? Lung capillaries, you have got 100 millimeters pressure. You have got leaving the heart, it is 85 millimeters. Leroy, you have to take full view here.
Full video.
Okay. Organ capillaries, it goes up to 50 organ capillaries. Everything is that microvasculature. Now that Google doctors also will come. Oh, what are you doing for microvasculature? Kind of stuff. So from cells it is 1 to 10, and from mitochondria it is 0.3% of the inhaled oxygen. And there is a kind of compromise in the air quality. What probably we will definitely get into that by going back to the roads. You are going to get affected. So this is what we worked on that.
Very nice.
All hypoxic. We have treated some cerebral palsy also with this hyperbaric oxygen. They were told nothing is possible or something is. We did sudden sensory neural hearing loss. Only thing is if they come before 2 or 3 months we can help them out. But this your idiot, this stupid cell phone can make you crazy. It will after 10 years it will help getting you into sensory neural hearing loss. You have to be careful what you are using. Cardiac indications are good. Only thing is it has to be done in that ICU setting, and we are not allowed inside the ICU. But finally, I'll be happy if I can get some questions, and so that I can always answer. Hyperbaric oxygen, cancer. Now most of the oncology hospitals they know here this Dr. Saxena is doing that. So they are keeping me busy.
In Delhi now, polio, phones, they all have it.
Yeah. Tarun is I know Tarun for so long.
Yes.
He started Hedgebot in Indraprastha 25 years back, man.
Right.
He's one of our. We have a hyperbaric group. Yeah.
Okay.
Tarun is amazing.
I have a question. So
Please.
You talked a lot about toxicity in the start of your lecture with respect to the heavy metals that are there. Right? We understood all the chemistry part of it. But the problem is that a normal Indian person cannot control where he's getting his vegetables, his water sourced from. Right? And the best in class RO purifiers do not segregate heavy metals as per my research. So, and you also talked about some of the ways you have given some detox treatment.
Exactly.
So is there any message that you have for us as well as for the doctors on what are the few things that can be done?
At the ground level. At the ground level.
Yeah,
You don't have to enter the.
toxicity.
Exactly. No, I keep answering that. I have something. We created small this one. What are the hacks? We call it as biohacks. You don't have to every time. You don't have to call your doctor and all that. So the thing is, there is when we talk about water filters, मट्टी के होते थे ना. You have to go back to that.
Gravel, sand, clay.
नहीं. Just मट्टी का वो जो कुंडा होता है. You use your RO filter, take out the thing, put in the earthen pot, and that is an amazing thing. And she has told me one very good advice. You told me sometime long back in one of the conferences. I think there are all glass bottles. Now my clinic, everything has glass bottles now. But glass bottles, she talked about something like structured water. So whatever water you get there, after that you put in the glass bottle and you put in the sunlight for 2 hours.
4 hours.
2 to 4 hours, or whatever it is. And it becomes a big difference. And
huge difference. I'm using it with autoimmune patients and with gut health.
Yeah. You don't have to go for Kang and water and all that.
Dehydration दिखाते हैं and they are good in 3 months if they do it religiously. Very
I think there are a lot of biohacks. We try to work on that. That is one of the few things we talk about.
Lot
And
spices and herbs are also chelating agents, so that is
exactly.
coriander detox.
Food adulteration. Whatever spices are also adulterated.
You have to go to Begum Bazaar and fix those people first.
Recently we got from Agra, donkey's dung is made up of that zira.
Achha.
Recently I am showing you for 4 or 5 months. And in Sangareddy we got 80,000 liters of milk.
अभी खाना खाने के बाद बात कर रहे हैं ना. Now it is okay. Otherwise you would not have taken.
It's going. Poppy seeds are made up of Fevicol.
Huh?
Yeah.
Dr. Farooq, I'll involve you in one of my talks. Please come.
Hundreds of there, sir.
Please come. I'll
Hundreds of
try.
there.
Hundreds of them.
It's a big thing. It's a big.
Recently we got in Sangareddy 80,000 of the milk is made up of melamine.
Oh yes.
So we are getting leukemias in children, small weight.
Big problems actually.
As per FSSI, you have a minimum amount of melamine in milk. How can you have minimum amount? I don't understand.
Yeah, seriously.
Right. So फसाई के जो guidelines है minimum amount के वो actually I think high time
ऐसा
to
है,
get revisited.
हम basically lactometer लेके हम
देखो
जो
Farooq,
collection point
what a minute. One thing I'll tell you. Whatever is it. This is the reason we have become doctors. We have problems and we should fix it. Right? Somebody comes to us and you can just give him some liver detox. Try to put simple thing like silimarin, put some NAC, NACs and all that, and his systems will start getting better. Only thing is you have to put in a proper way how you can always get over that. Abhi dekho, you can't stop this incoming.
Yes.
You have to have something like not mohalla clinics. You need to have something like far infrared sauna clinics.
Yes.
The clinics what we run,
Right.
this is the need of the hour. I am sure was horrible stuff. Everyone takes up health. Everyone is interested here. Everyone talks about health and all that, and everyone looks at that small quick fix. It's not enough. So for some reason, I don't take milk. I tell none of my patients to go for any milk. I tell them not to. We have now with NIN, we did a study with Dinesh Kumar. We are able to show high levels of lead in milk, in Hyderabad milk.
Very dangerous. Definitely your children will go and die.
See,
इतना pessimistic मत बनो.
है sir. Really?
everyone is talking about this glyphosate poisoning. But I'll tell you, there is something more
Come here.
more
I'll
thing
say.
than glyphosate.
I've got. Come here, come and talk.
And we
Come
thought
here.
you are wanting to take one more lecture, Dr. Praveen. No?
Abhi. Madam, energy level, mitochondria is not there. I have been up since morning 9:30, you know. When coming from
I was in the
place,
room at 9. I forgot that the session starts at 11. And I called
Hyderabad will
Manjari.
start only after 10:30, 11. It's not like
It's not like
US,
Delhi that we start at
then
7:30.
7:30. Come on.
नहीं सर, हम लोग नहीं आएगा आपका कॉन्फ्रेंस में.
Okay, तो आप आगे आओगे, पहला सेशन आपका ही रखूंगी.
So this
Here starts with after 10:30. खाना खा के डकार लेके चाय पी के फिर डॉक्टर साहब है क्या पहले हैदराबाद इज लेट लतीफ एंड ऑल दैट
कैलकटा उससे ज्यादा लेट लतीफ कोई नहीं हो
Calcutta
सकता.
people are amazing.
They are
They
so.
they do work for 3 days. 3 days छुट्टी मारता हूँ.
नहीं छुट्टी नहीं. They are not even worried about money.
I know a lot of goldsmiths and
Oh,
all
yes,
that are my
yes,
patients
yes.
actually. They take 3 days off.
No, and they're
बहुत
very
काम कर लिया
careful
बस.
about each other. But काम में they're very clear. बस
नहीं,
इतना ही हो.
but I think Mumbaikars are the best people. He is a Mumbaikar. He
Very
works like
professional.
anything.
Yeah.
Big clap for Mumbaikars.
See,
That's
one
what.
thing-
Any questions still?
one thing
Huh.
Any questions? Otherwise, we'll move to the next session.
One thing I want to tell is about this glyphosate thing. The whole world is talking about glyphosate. Everybody talks about glyphosate. It is impossible to take out glyphosate from many of the foods because it is going intracellular.
Interesting.
Secondly, what people don't the lethargy of people have increased. If you see in your population today,
Yeah.
why that is happening? Because there is one other insecticide which is called neonicotinoid.
Oh yes.
Now this neonicotinoid is used in all these pet collars. You know, you have if you have a dog or pets, they have the
I have two
collars.
dogs. I'll tell you one more thing. I keep telling patients and all that to be with this. I ask them which is the thing you use. Hit
Yes.
cockroach ka. Oh, we use hit. All out use karte. It is not going to hit the cockroach or mosquito. It will hit your mitochondria. And people are not aware about this.
Neonicotinoid makes the
It is very
mitochondria sleep. So that's why
Yes,
people
yes.
feel lazy. And
I
you
think,
take how much
I think,
supplement you wish.
Dr.
Unless you
Manjari,
take out
nobody is sleeping.
neonicotinoid, nothing will happen.
Because I told you, we'll make it quick.
So as they say, charity begins at home.
Yeah.
So we need to have a session where we are taught what are the basic things that we can.
चप्पल छोड़ के आओ पहले घर में घुसने के पहले चप्पल छोड़ के जाओ.
Basic
Don't take.
चीजें से तो पहले
I was told by in Seattle by one of my big mentors, and he Dr. Klinghart's practice. All people are leaving their footwear outside. Then he said me, I learned this in India. बोलता.
हाँ, बिल्कुल.
So we
Sorry.
need to have a session where we are taught what are the things that we need to change.
Yeah.
So that
We
we
have-
can tell the
we have-
patients.
we
First
have.
we have to include in our lives.
I try to, if somebody gets plastic bottle and he's a known patient, I charge him double. I said this is a fine we are implementing on.
Slowly it's going poison.
I also charge double to the all Google doctors who come to my clinic. I asked them first, if you studied Google and you want to be inside.
No, I have only one thing for them. I said, you want to read medicine? There is a separate session.
नहीं.
I cannot teach in a clinic. I cannot.
You
There
pay
are
double,
8
then
people are
come and
waiting.
ask me
I
questions.
can't teach you
otherwise
medicine on that.
बहुत मुश्किल है otherwise.
Should we carry glass bottles?
Yes. Or steel bottles also. There are very good steel thermos available.
Your fridge bottle also. Gita, I have been telling this for the
But
last 20
again,
years.
I am not very sure because when we do oligoscan and onla,
I
कहीं छोटे कपूर भी है
had
यार.
my own experiments in my family. My father's friend.
I don't use it aftershave
He's
also.
fit. He's not.
I don't
diabetic,
use
don't
any
have
chemicals.
on time. But using the purest copper form, the utensil to
I
carry
agree,
water.
but what I'm saying is that I find people with high copper also these
We
days.
do a lot of stuff.
तो इसलिए copper bottle for everybody?
No,
I
I
am
was
not.
told कि
Copper poisoning के तो अलग भी sources है.
पर चेक करके यूज, फिर और ऐड क्यों करना है ना उसमें?
नहीं, but utensil what I'm telling
नहीं
you.
नहीं सर, आपका घर में जो पाइप है स्टील पाइपिंग है.
I think
नहीं,
I
I'm telling you what.
अरे
25 years back you
Farooq,
have
some other
steel
session,
piping.
some other session.
Sorry.
Come on, because it will
Sorry,
be a
sorry.
kind of thing. I think you have, because I can go.